You all are welcome to my channel. Today I'm going to discuss a very important topic that is very helpful to you, and that is the position and their uses. Before going ahead, if you are new on this channel, please subscribe the channel and hit the bell icon. Without wasting the time, I'm going to start the topic. So here the first position, and that is supine position. As you can see the image of supine position, the person is lying to the surface of the bed. It is like that. It is a back lying position with arm on the side. And what is the uses of this position? There are so many uses of this position. It helps you in physical examination of a person, help in resting, help in undergoing anesthesia, lung biopsy. It is a very helpful position in all these things. Now, the second position is dorsal recumbent position. If I describe about this position, then it is also a back lying position. In the patient's head and shoulder may elevated on the small pillow. Arms are resting on side, legs are apart with knees flexed and foot resting on the bed. Now, if you are talking about the uses of this position helpful in many things. Number one is physical examination of abdominal and genital area. The second thing is it is helpful in perineal care, and the third thing is it is helpful in PV examination. You can also see the image for the better understanding of the position. Now, the number third position is Trendelenburg position. In this position, patient is lying on the back with arms on the side. In this position, bed is positioned in such a way that head of the bed is lower than the foot of the patient, and there is no flexation at the waist level. It is something like inclined plane, but here the ends are free. Now I'm talking about the uses of this position. So this position is helpful in many things. Number one is it is helpful to shock patient. It is helpful in hypotensive patient, helpful in cord prolapse patient. It is also helpful to shift abdominal organ inward, like that it is upward during certain surgeries. Air embolism, which is very important, and it is helpful in air embolism. Now I'm talking about the low Fowler's position. In this position, the head of the bed is elevated at an angle of 30 degrees with flexion at the level of waist. If I talk about the uses of this position or the benefits of this position is very beneficial to prevent aspiration during tube feeding. Also used during increased ICP. Now I am talking about the next position, that is semi-Fowler's position. In this position, the head of the bed is elevated at an angle of 45 degrees, and the flexion is at the level of the waist. If I talk about the uses or the benefit of this position, then this position has a lots of benefits, like to promote lung expansion, to relieve tension on surgical side following abdominal surgery. Also beneficial in trichoesophageal fistula, and also helpful in paracentesis. Now the next position is high Fowler's position. In this position, the head of the bed is elevated at 90 degree, or we can say the bed is at the right angle. and the flexion is at the level of the waist. If I talk about the uses or a benefit of this position, then this position has a lots of benefits, like to prevent the risk of choking and to relieve respiratory distress. Also helpful in nasogastric tube intubation, helpful in ARDS, also in asthma, also helpful in COPD and emphysema, and also useful in pleural effusion. Another position, and that is orthopenic position. In this position, since this position, patient is sitting on or side of a bed with an overhead table to lean forward. Pillows will be provided to increase the comfort level of the client. It is like that you are sitting on a bed and head down on the table on the bed. If I talk about the uses of this position, it is helpful to relieve respiratory distress. It is helpful in thoracentesis, helpful in ARDS, helpful in asthma, helpful in COPD, helpful in emphysema, helpful in. It is also helpful to pericarditis patients. Now the next position is prone position, and in this position, patient lying on the abdomen with the head turned to one side to promote comfort. Pillow can be used under the head, and a small pillow or towel roll can be used under the abdomen. So you have to use two pillows. The one is you have to use two pillows. The one is under your head and the second is under your abdomen. Now I'm talking about the uses of this position. So it is helpful to prevent aspiration, helpful to recovery position after anesthesia. It is helpful to relieve pressure on the back or coccyx, and it is helpful renal biopsy. It is helpful neural tube defect. It is helpful position after spinal surgery, and also helpful in hemorrhoidectomy. Now I'm going to discuss the next position, and that is lithotomy. In this position, I'm going to discuss the description, and the description is like that: lying on back with legs flexed at hips and knee joint, and legs are supported with leg rest and strap. If I talk about the uses, then this position is used in childbirth, used in pelvic gynecological surgery, used in. It is also helpful in transurethral resection of prostate. Now, the next position is knee chest position, also known as genupectoral position. In this position, patient rests on the knees and chest with head is turned on to one side, arms extended on the bed and elbows flexed and resting so that they partially bear the patient weight. The abdomen remains unsupported, though a pillar like support, that is used with a pillow, may be placed under the chest. Though a small pillow may be placed under the chest. In this position, severe hypotension occurs because of pooling of blood in the extremities, and this position is helpful in sigmoidoscopy, lumbar laminectomy. Now the next position is Sims position. In this position, patient is lying on the left side with semi-prone position. One arm is located behind the patient and another is flexed at shoulder and elbow. Both legs are flexed at the level of hip and knee, but the upper leg is more flexed and is drawn up to the level of chest. It means that your upper leg it is very flexed and it should be drawn to the position level of your chest. This position is helpful in many things like that. rectal examination, administering anemia to prevent aspiration. Now the next position is lateral position, and in this position the patient is lying either on left or right side with hip and knees flexed. Top leg is front of the bottom leg. In this position, pressure on back and coccyx will be relieved and pressure is distributed along the scapula, lateral aspects of the ilium and the greater trochanter of the femur. This position is helpful in many things like to prevent lungs and cardiac function, to relieve pressure on the back and coccyx. It is helpful after liver biopsy, right? Lateral position, patient with pyloric stenosis after meals, right lateral to promote entry of food into the stomach and intestine during seizure attack and air embolism, left lateral. So I hope you all enjoy this video and it gives you a lot of information about the position which is very helpful to you. If you like this